the connective tissue release part of your program. The first one is Annie's rolling the bottom of her foot. We're using a lacrosse ball. You can use a golf ball or a tennis ball. Go ahead and switch your feet. Try to go a little bit slower now. Get right in the arch. Okay, the next one is going to use the foam roller. And the first one is her shins. Yeah, right there, good. Okay, get on the shins and you're just sort of doing rolling forward and back almost like a knee tuck. She's also going to, in that position, she's going to go on her side so she does her Peroneals, which is on the outside. You can do one at a time or two. She's just rotated on the outside. Come to this side, and that will get the peroneal muscles. We need that. That one's going to get tight as you go for your walks. Okay, the next one is quads or thighs. So that's the front part of your legs. So you'll lay on the foam roller. The first one is keep your legs straight. Now we want you to bend your knees up, still roll. We want you to stop rolling for a second and bring your feet down and bring them up. Bring them up towards your fanny. Bend them back down. Bend them on up. One more time, bend them down, bend them up, and then keep them bent and roll again. From there, we'll do the abductors or the groin. So you're going to angle the foam roller. Start with a good knee bend and start on the inside. Start on the what we call the VMO muscle. About 10 rolls or so, and gently work your way all the way into the groin. You can angle the foam roller like Annie did towards her or away from her. Okay, last one. Good, let's go ahead and switch sides. Angle the foam roller away from you this time, so more of a diagonal angle away from you. Yep. Again, you start by bending the knee, doing the VMO, the inside of the knee. Okay, go ahead and roll again in towards. From there, Annie's going to do the hip flexor. So you're going to put your foam roller straight, and it's the indentation between your abdominals and your leg. So stay right there. Yeah, go ahead and roll. Okay, go ahead and switch sides. Okay, the next one you're going to do is we're going to do the back side now. So we're going to start with the calf. You can do one at a time or you can do two. Annie's doing one right now. If she wanted to do two, she'd put two on. If that's not enough pressure on your calf, you'll put one foot on top of the other. And that will generate a little bit more pressure. From there, she's going to do the hamstrings or the back of the legs. So you just roll the foam roller up a little bit higher. Get up on your hands, roll back and forth. Now from here, she'll do the piriformis and glutes. So what she's going to do is sit on it, and then she's going to put her right hand down and lean into the foam roller on the right side with her right leg over her left leg. From there, Annie's going to stay on that side, and we're going to go right into doing her IT band. So she's going to lay on the side. She can put her elbow down, leg over, and she starts at the hip. Again, 10 or 12 rolls. And then slowly roll the foam roller down. So you're going to go up at the hip, about mid-thigh, and then lastly right outside the knee. If that hurts, you can also just hold it and breathe, and that will eventually release, so it will act like acupressure. Okay, we'll do the other side. So this time, it's the left hand down, left hand leg comes over, opens up the piriformis. Try to find a spot and roll in there. So from here, she'll do her IT band. She'll lay, her elbow goes down, her right leg is straight, her left leg is straight, right leg comes over. Okay, go down a little bit lower. About 10, 12 rolls, and then now right outside the knee. And the last one she's going to do is her mid to upper back. Put the foam roller basically underneath the shoulder blades. She's going to hug herself. And she's just going to roll back and forth. She's going to roll a little bit to the side. More of at a diagonal angle. She'll do both sides like that. Now we're going to do a little spinal flossing by having her pass her hands back and forth. Over her head, do one at a time. Pause. Good. Switch hands. Good. Switch hands. Switch hands. You can tuck your neck, your chin to your chest. That will help protect your neck. And then she's going to go back and roll again. Trying to get wherever she's sore, wherever she feels those knots. That completes your connective tissue foam rolling.